may have noticed that we're all wearing pink today, and our studio lights are also pink, and that's because it's Go Pink Day here at 22 News.
And 22 News has partnered with the Mass General Brigham Cancer Center at Cooley Dickinson Hospital to raise awareness about breast cancer. Joining us tonight are Dr. Dan Siddiqui, Medical Director of the Mass General Cancer Center at Cooley Dickinson Hospital, and Glenda Flynn, an advanced oncology nurse practitioner. Thank you both for being here with us this evening.
Thank you for having us.
All right, so Dr. Siddiqui, this question is for you. What is the typical survival rate for someone who is diagnosed with breast cancer? What are some of the factors that can affect this?
So the most important factor is the stage of the disease. And in general, cancers are staged from stage 1 through 4. So early stage cancer, which is confined to the breast, has over 95 to 99% cure rates. And that's again so important to be able to diagnose cancer at an early stage, and that brings up the importance of screening mammograms. Localized cancers, when cancer has spread to the lymph nodes, has over 80 to 85% cure rates. And once cancer has spread to the other areas, stage 4 cancers has 25 to 30% long-term survival. Stage 4 cancers are not considered curable.
And Glenda, this question is for you. When should women begin getting screened for breast cancer, and how often should they be getting screened?
Well, women who have average risk of developing breast cancer should start having mammograms once a year at the age of 40, between 40 and 50. At age 50, definitely once a year, and up until the time that they have less than a 10-year life expectancy, they should continue to have annual mammograms. Of course, women who are at higher risk might need additional screening modalities, including breast MRIs, but the average risk woman should start having annual mammograms at age 40.
Dr. Siddiqui, back to you. What are some of the ways that doctors are treating breast cancer today? We hear about chemo and radiation, but are there other options for people?
So there are 3 main modalities of therapies, and the number 1 is surgery. And it's always important to try to remove the cancer if it is surgically removable. And second is radiation therapy, and third is systemic therapy. Systemic therapy are of many different types, and chemotherapy is one of them. In breast cancer, we also using immunotherapies in certain cases, and one very commonly used therapy is endocrine therapy. So those 3 different sort of systemic therapies are used in breast cancer patients.